From the Human Rights Commission is Alison Aggarwal. Alison.
Good morning everyone, and thank you very much. And thank you to COTA New South Wales for convening this fantastic parliamentary forum today, which gives us a real chance to look at these issues of women work and care. And thank you for inviting me to join the panel as well. Before I begin, I would like to acknowledge the traditional owners of the land we are gathered on today, the Gadigal people of the Eora Nation, and pay my respects to their elders past and present. I'd also like to acknowledge any Aboriginal and Torres Strait Islander people here in the audience with us today. As I said, I'm really glad to be able to speak today, and particularly on this issue of recognising and valuing unpaid care. Just to give you a bit of a picture of what women work in care looks like. There are 5.5 million people, unpaid carers in Australia today, which is approximately a quarter of Australia's population. In 2009, 4.1 million employed people were carers of children or other family and household members, which is nearly 2 in 5 employees. And as we've heard today, it's women who are more likely than men to be carers, and women who have care responsibilities of greater intensity. We know that in the 15 to 64-year age group, 72.5% of primary carers are women, and that 92% of primary carers for children with disability and 70% of primary carers for for children are women. At some points in our lives, everyone here today will be involved in a care relationship, whether it is as a recipient of care or as someone who is doing the caring. I think it was Ben who sort of pointed this out, but interestingly, even though we know that the majority of care is done by women, the one area where men care equally with women is in later life. Men comprise around half, that's 48%, of the primary carers for partners. Despite this widespread caring work that is done, and largely by women, what we know as well is the fact that caring is not economically valued in our society. And it's time we considered the impost of care on the people who provide it. Some of that impost, unpaid carers have significantly lower rates of workforce participation and are more likely to work in part-time and casual jobs. So 66% of employed women with children aged under 6 years worked part-time, compared to just 7% of employed men with children of the same age. We also know that less than 23% of female primary carers of people with disability, illness or frailty participate in full-time employment at any point across all age groups, compared with 52% of men. We know that across Australia, one of the critical challenges we are facing is the gender gap in retirement income and savings. The average superannuation payouts for women in Australia is just over half those of men, that is 57%. And as we've heard today, this is the result of gender inequalities experienced by women over a lifetime, both in terms of stepping in and out of the workforce to undertake their caring responsibilities, but also in terms of the gender pay gap, which Heidi spoke about as well. In 2013, the Australian Human Rights Commission, which is where I work, and I work for Elizabeth Broderick, who's the Sex Discrimination Commissioner, having an understanding that this was the picture of women work and care in Australia, and having an understanding that what we're finding is that a number of women, a significant proportion of women in their later years, are accumulating a situation of poverty. We wanted to do some research into looking at exactly what this impact of unpaid caring work is having on women and their retirement income savings. But critically, we wanted to look at what could actually be done about it. So in 2013, the Australian Human Rights Commission launched the results of some research, which we undertook over 12 months in conjunction with the Social Policy Research Centre at the Australian University of New South Wales, and it was funded and supported by Westpac from Jane, who you heard from earlier. The report's titled Investing in Care, and the research examined how best can we recognise and value unpaid caring work in our societies. I haven't got a PowerPoint with me today, so some of the statistics and data that I've shared with you might have been a little bit too fast, but it is all available on our website, and I have got copies of these reports outside as well, so and I'm happy to follow up with anybody who needs that information. A little bit about the report. So Investing in Care identified a number of options for reform for adoption in Australia to reform the current system of retirement income and savings, including the age pension and superannuation, to account for the inequity of retirement incomes and savings that leaves many women in poverty in older age, especially women who are or have been unpaid carers. The report suggests 11 options for policy reform, drawn from research and analysis of a range of mechanisms and models used to value unpaid caring work, not just in Australia, but in 24 countries around the world. So it really was trying to look, having understood that there's actually some systemic barriers and some systemic challenges in this picture. What are some of the systemic solutions that are being used elsewhere in other countries, and how could they apply here in Australia? So the options for reform covered areas including strengthening and furthering development of legislation, flexible work arrangements, which we've heard a bit about today, looking at income support strategies, some leave arrangement strategies, what sort of resourcing we need of services, support services for carers, and what workplace initiatives are there to evolve workplace cultures around this issue. And finally, the sixth one, looking at reform of the retirement incomes and savings system itself. What was clear was that there's no one policy solution, but rather that there's a range of reforms that are needed. So let me spend a couple of minutes talking about them. One of the areas for options for reform was legislative reform. So carers have the lowest collective well-being of any group in Australian society. The introduction of the Federal Carer Recognition Act in 2010 was a first step to formally recognising the value of care. But it doesn't really confer any rights on those who care. The Equivalent Act in the UK enables carers to receive an assessment of their carer needs, encouraging local authorities to support them by providing appropriate services. So one of the options for reform that we considered was, could we have some sort of right to a carer's assessment established here in Australia? Another one of the biggest hurdles that we found in terms of the systemic problems in the unpaid caring debate was actually the stigma that's associated with caring itself. And really what we looked at was that we need to address the gender role stereotypes and social norms that have become associated with unpaid caring and workforce participation. We need to challenge the ideal worker model of a person, and Ben spoke a little bit about this ideal worker model, who's usually a man and unencumbered by caring responsibilities. What we need to look at is what is the new norm for a worker model, where men and women equally share the responsibility for unpaid care and can equally participate in work. A lot of this will require encouraging men to be involved in caring right from the start. And so that's something that will only come about with a national conversation on what is care and what are responsibilities. One of the, I think, probably most intriguing options for reform, which I'd really like to focus on today, and that is this idea of caring credits. Many countries around the world with social insurance-based public pension schemes have introduced the means of crediting a person's public pension scheme while they are out of the workforce providing care. This is what's called carer credits. Some of the countries which have introduced caring credit systems include Sweden, Canada, Finland, and the UK. In the UK, the carer credits for parents have recently been extended to grandparents who provide care for a grandchild under 12 years of age for a minimum number of hours per week while their parents work. And interestingly, some countries are extending the carer credits beyond care for children to to care for all sort of members of your family or friends who may be elderly, or who may be sick or chronically ill, or who may have a disability. Some of the carer credit schemes, such as those in Germany, continue to provide carer credits when individuals return to work part-time. These credits can top up an individual's pensions contributions to the value of what they would be if the individual was working full-time. In Sweden, France and Poland, they're including carer credits in private or occupational pension schemes. In these cases, the state either contributes to a person's private pension account while they are out of work after the birth of a child, or takes over the employer contribution during certain periods of workforce absence. So the international literature revealed that these are an effective mechanism for encouraging women's attachment to the workforce while continuing to provide care. It also helps to alleviate poverty in the present time through additional income, and in the future through improving retirement incomes. While these caring credit schemes operate primarily in public pension schemes, their usefulness as a measure for recognising periods of care in the retirement income system make them an important mechanism to consider in the context of Australia's superannuation scheme. One area that such a system has been considered in Australia is to include a superannuation component onto the paid parental leave pay. So as we've heard, private companies such as Westpac have added the superannuation onto their paid parental leave scheme, and the proposed new paid parental leave scheme by the current government also proposes to add the superannuation onto the paid parental leave. But women undertake unpaid caring work not only for children but also for family and household members with disability, for those who are chronically ill or frail due to old age. So we need to consider whether caring credits could be payable across all forms of unpaid caring work. One of the things that the Commission has recommended is that the Productivity Commission conduct an inquiry into mechanisms for valuing unpaid caring work, including caring credits, to model and cost how such a mechanism could be successfully implemented here in Australia. I should also note that one of the things that would have to be considered when looking at a caring credit scheme like that in Australia's superannuation scheme would be to reconsider some of the taxation provisions around the superannuation scheme so that it doesn't disadvantage lower income people in that area. At the same time, one of the other things that we also suggested as a sort of at the beginning I sort of mentioned that there's just one policy reform isn't going to fix it all. So one of the parallel kind of policy reforms was to also consider the introduction of a care bonus, and that would be an additional supplement to the age pension for unpaid carers who've made substantial contributions to care over their life. So that's for all the people up to date who wouldn't be able to take advantage of a caring credit scheme. How do you compensate them? Investing in care, we found, was quite a critical report that instigated a national conversation about unpaid care. And one of the reasons we found that was really important to have it was because we wanted that conversation to attribute recognition where it's deserved, namely to acknowledge the work of those who care for children, those who care for people with disability, and those who care for people who are chronically ill, as well as for older people. One of the components of the report was the production of a toolkit for employers that provides practical examples of mechanisms that workplaces can use to support unpaid carers and help them to meet their caring responsibilities. I have some copies out there if you're interested, but some of the examples that Jane shared in terms of what Westpac's doing to support unpaid caring workers are contained in that report, and it's examples such as those that really lead the way in terms of what companies can do in this area. I also want to give you another example, which is in 2013, after we released the report, Rice Warner introduced a suite of measures to address the gender gap in retirement income and savings. And what we particularly appreciated about this package of measures was that it included several different initiatives. So in addition to introducing a payment to female employees of an additional 2% superannuation contribution while employed at Rice Warner, They also provided 18 weeks maternity leave at full pay, a superannuation contribution on that, and for up to 12 months, and long service leave. So the superannuation was payable for up to 12 months, as well as on long service leave accrual through maternity leave. They also introduced flexible working arrangements, and they also included an education program to build awareness of the unique challenges women face in saving for retirement. So I just wanted to say it's encouraging to see strategies such as this, which were canvassed in our toolkit, but it's very exciting to start to see them being taken up by both the corporate and non-corporate sector. Interestingly as well, there's been a real initiative within the New South Wales government to develop a New South Wales carer strategy. And I think part of that strategy as well has been looking at what can workplaces do to support employees who are carers. I also just wanted to mention that we are talking about unpaid caring work here in the context of Australia and its impact on poverty, particularly older women's poverty. But this issue has also been taken up at the international level very strongly in the last 6 to 12 months. So there was the UN Special Rapporteur on extreme poverty has specifically looked at this issue of unpaid caring work and its impact on women, and particularly across the lifetime for older women. And looking at that issue of poverty and that accumulated poverty, and she's done an excellent report on what that means for countries around the world and what measures countries around the world can take. And she refers to the report that we did, Investing in Care, as one of those areas of examples of what kind of systemic reform could be introduced in countries to deal with this issue. And I think some of you may know that we're going into a post-2015 development framework at the international level. And one of the things that people have been advocating for is that when we're looking at development and economic development in particular, that we really need to place at the front and centre of that this issue of unpaid caring work. And what does that mean in terms of global economic development? So I think it's interesting that we're here with COTA grappling with these issues, and it's useful to know that these issues are being equally grappled with at an international level as well as right here in New South Wales. So having women live their retirement years in poverty due to a lifetime spent caring is a critical issue for Australia that must be addressed. It is wonderful to see people coming together to recognise the issues of women's work and care and considering measures that can make a difference to changing this picture for the future. So can I leave you with this thought? Now is the time for bold and innovative thinking, thoughtful analysis and collective commitment so that in the future no one will retire in poverty because they chose to care. Thanks everyone.